Hello, listeners, and a warm welcome to Views on Health. A great pleasure to have with me on the program today Dr. Hasitha Liyanarachchi, consultant pediatrician, Lady Ridgeway Hospital in Colombo, the leading premier children's hospital in Sri Lanka, and Dr. Hasitha Liyanarachchi is also senior lecturer in pediatrics, Faculty of Medicine, University of Colombo. Welcome, Doctor, to the program.
Okay.
And for the information of our listeners, as a consultant pediatrician, Dr. Hasitha Liyanarachchi is going to focus on the life of a baby from day one to the first year. That covers quite a period in the life of a newborn from day one till the baby is 1 year old. And I'm sure there'll be lots of interesting things that Dr. Liyanarachchi is going to share with us on the program. Over to you, Doctor, to tell us about the baby from day one.
Okay, Ms. Fatima, actually, I was also wondering what to select when I was invited to talk. Then I thought this would be a more interesting topic for our mothers, especially first time being the mom is really hard. And without any experience, so they have to go through a lot of hardships. So I thought that it's good to talk about from feeding up to the development in an infant. Okay, so first we'll talk about the feeding. Yes, we recommend all of our newborns to be exclusively breastfed up until 6 months of age. So, but to start this process is not that easy as it is. Even though we are asking them to breastfeed, the mom is finding it difficult. The baby is new to this job. So both parties are new. So it needs a lot of coordination and encouragement and a lot of things. So first few days we recommend them to, usually we say breastfeeding on demand. So when the baby is ready, baby is asking to offer them. But for first few days, this is a bit more challenging. So I would recommend for you to try every 2 to 3 hourly to start with. But after a few days, you can practice it as on demand. And then the other thing is, even though we tell them, they find it very difficult. Like the very common complaint is, I feel I don't have enough milk, and I think my baby is not feeding enough. So doctor, can you prescribe a formula? So that is the common request from most of the moms. So they need a lot of support from us, from the family and from the husband especially, and from the medical team around. So it's like that. First few days, you don't produce much milk. And baby indeed doesn't require much of milk. But over next few days, you start secreting milk, more milk, depending on how much the baby is taking. So if baby is taking a lot, you're going to secrete a lot. It's like that. So it's always worth trying again and again. Okay, so you're not going to fail. So as a human being, females can secrete milk. There's no problem with it. It's just how to establish the breastfeeding. Okay, so and the other question that they ask from us, like, I'm feeding, doctor, but still I feel the baby is not getting enough. So how we are going to reassure them? So you can, up to a certain extent, you can decide it depending on the weight gain. That is the most objective way of assessing the level of feeding, whether the adequacy of feeding. So if the baby is achieving the expected weight gain, that means that baby is getting enough milk. How much you feel that you don't have enough milk? If baby is achieving the expected weight, then you don't have to worry about it. Another thing is the urine output. If you are talking about the urine, for first few days, they don't pass a lot of urine. They might just pass 2 twice or thrice in a day, like for first few days. But over next few days, they start passing more urine. By 10th day, more than even 10 times per day. So parents find it very difficult to change the nappies. So it's like that. So that also helped the mom to identify, or to understand the adequacy of the breastfeeding of her newborn. So these things might support, and sometimes the mom might feel the breast are getting emptied with the feed. So these things might help the mom to understand the adequacy of breastfeeding. So it's about breastfeeding. So breastfeeding is going to be continued up until 6 months, exclusive breastfeeding. Unless there are other medical indications, we never recommend formula feeding. And it should be always under the recommendation of a doctor. And as a mother, you should never take that decision, because as we are humans, so we are going to feed our own babies with cow's milk. Okay, so it's like that. So by 6 months, we recommend them to start on complementary feeding.
Thank you, Doctor, for that introduction, very detailed and lucid. A question. When you say the baby has been fed on demand, now which means even in the night, the baby doesn't know between day and night. If I'm right, I don't know.
Yes,
and that's
correct.
at that point in time. So even at night time, the baby can demand, so to speak, by getting up and crying, and then the feed has to be given. So that, of course, then interferes with the mother's rest period, okay?
Yes.
But I think they all accept it and put up with it about the sleepless nights, or rather,
As a mom.
the disturbance of, a night's sleep. The other question I want to check with you, Doctor, is about stools. Now, they pass urine, you said for the first few days it'll be less, but then by day 10, it becomes like,
10 to 14,
more frequent.
even,
Yes.
more frequent.
So that is okay. I'm sure that's acceptable, and with this inconvenient or otherwise, changing nappies and diapers has got to be done. But about stools.
Okay. So first I'll answer your first question. They don't know whether this is night or day. It's very important for these moms to train newborns and to somehow put them into our circadian rhythm. Because otherwise, moms will be disturbed in the night time, and it's very difficult for them. So it's like this. In utero, inside mom's tummy, even though they can see these newborns, it's dark. So once they're out, so we should train them. Okay, so in the daytime we should keep them under good light, and there should be noise around. Okay, but in the night time, what I recommend personally for my patients, like by 6 o'clock, go to the bed with the baby and switch off the lights. Okay, because parents are scared of their children, babies, especially babies, newborns. So they try to keep the lights on most of the time. So we are not allowing the baby to realize this is the night time. So we should train them. So switch off the lights. After 6, be with the baby on the bed, and then after a few weeks they're accustomed. Okay, so they will have a good sleep overnight. So after a good feed, a normal healthy neonate can even be without a feed for 5-6 hours. You can don't ever disturb them in the night time to give a feed, because that's not really recommended. But they will wake up for the feed, they will feel it, and they will wake up. That is the answer for your first question. And for the stools, it's a good question, because the stool consistency, color, the frequency, all these matters for these moms. Usually we expect them to open their bowels within first 24 hours. usually they pass a tarry black color stools. We call it as meconium. And after a few days, they like the color of the stools changing from this dark black color to yellow color that we expect them to have even as an adults. So this transition happens within first few days. By 5 to 6 days, we expect them to pass yellow color stools. It's a bit watery, like dal curry, and sometimes it could be a bit frothy as well. It's still normal. And the frequency, if you take the frequency could vary from once in 3-4 days to 15 to 20 times per day. So there's a huge variation, but still normal. That's what you have to understand. Depending on the baby, the number of stools that they pass is different. And other thing is the color. There are different colors because we expect them to have pass yellow color stools. But if it becomes pale, it's alarming. Okay, it becomes pale, it's alarming. And if it becomes red, obviously parents will be frightened to see that. But if it becomes pale, they may ignore. They may still consider it as normal. No, it's not normal. Go to a doctor. Show the color of the stools. And the other thing is the green color. Green is also like in between. Green is a bile. The original color of bile is green. So when it because it's secreted at the upper part of the gastrointestinal tract, and when it passes down, the color changes to the yellow. So when they pass greenish color stools, you don't have to worry about it. It just because on that day the bowel movements are a bit high in that baby. That's all it indicates, nothing else. You don't have to worry about the green color stools. But red color stools, pale color stools, you need to go to a doctor.
So what triggers off the variation in color, the red and the pale?
Yeah.
What brings it about?
Yes. If it is pale, that means whether the bile is not secreting into the gut. So whether there's an obstruction in the tract of the bile. So that is alarming. And if it is red, obviously, blood, that we are suspecting blood with the blood mixed with the stools. So there are multiple causes for a child, baby, to have blood mixed stools. So that has to be evaluated by a doctor or pediatrician and sort it out accordingly.
Thank you, doctor. So it's interesting. So we have sort of, I would think, past the first few days or weeks of the baby's life. And then going on from there, whilst the various vaccinations are given to the baby, I guess we are going to get into that right now, but that is a factor that we need to take into consideration. Okay. But going on from there, at what point, though you said for 6 months exclusive breastfeeding, so then nothing happens there in those first 6 months.
Yes.
Then what is the next step thereafter?
With regards to feeding?
In terms of feeding, yes.
Feeding.
Yes.
So if you take feeding, yes. So that is the right time for us to introduce other food. This is again a big change for the mother and for the baby. So this is again a point where most of our parents go wrong. Okay. Up until 6 months, if you take the growth of our newborns, it is highly satisfactory because we as a country, we encourage breastfeeding, and our rate of breastfeeding is very high compared to other countries, so we should be proud of it. But when it comes to introduction of other food, our parents find it difficult to do it optimally. So what happens, what we recommend, to start it gradually, starting from rice, and one by one adding vegetables, animal source food, and the consistency we recommend is something like a paste to start with, and gradually the consistency has to be changed, okay, more solid. So this process, even though we advise, those information are there in this book, which we call it as a child health record, CHDR. Still, parents are finding it difficult to manage that part, and the weight gain affects during this time. So we have to be very careful. So this is a new thing for the baby as well, no? And for the mother as well. So sometimes some parents might overfeed with these breast milk. So then the appetite is no more there for the baby to accept the other food. Without solids, the energy density is not enough for that particular baby to gain weight. So the outcome is really bad, the poor weight gain. So that is the challenge. So we encourage them to read this book, and a lot of information there. So you can go through it, and you can refer it again and again, still worth. And if there are questions, you can contact your family health midwife or the medical officer of health, emotion. So, and get the advices and follow those instructions, because this is the period where the child's growth is a high chance this child's growth is going to be affected. So it has to be done very carefully.
Doctor, what about fruits?
Yes, fruits, they love fruits because it's sweet, no? It is sweet, so they love fruits. To start with, yeah. So we can advise to start fruits as a snack. So initially we are asking them to start with 2 main meals and a snack. So you can use a fruit for the snack, but main meal should be comprised of rice, because that's our staple food. Okay.
Going on from there now, by about this 6 months, the baby would maybe try to turn, or not, or with it varies from child to child, because not all children can turn at the same time, or some may be a little late.
Yeah.
In trying to turn.
So you are talking about the developmental milestones.
Yes. The physical development.
Yes, physical development milestone. Actually, if you take the development of these infants, children, it's a vast area. There are 5 domains. To start with the gross motor, that's what you have asked about, the rollover and walking, running, all under the gross motor milestones. And the fine motor milestones are there. Yeah, fine motor means fine, like voluntary grasp and transferring objects and taking tiny objects from 2 fingers. So those are fine motor activities. And then hearing and the language, this speech development. And then the cognitive development, the intelligence, cognitive development, and the social development. So it's a vast area. So we actually monitor these things in our clinic visits, and parents also are advised to monitor it at home. So those tables are there in that book, so they can refer, and they're supposed to tick. So I advise them to do that, because you are checking with your doctor. Then the chances of missing is minimal, because the whole point of doing this is not to miss these things. Because if there's a problem with the brain growth, then the way that the things are going to be manifest is the developmental milestones. So if there's a delay that we pick, then we have to look for the cause and to treat if the treatments are available. So if we postpone, or if we couldn't find it on time, then the chances of good outcome is less. So that's why from day zero to 1 year, we are very carefully monitoring their development. So as you have mentioned, at 3 months, we expect them to maintain their head without any support. If it is not there by 4 months, it's alarming. You should go to a doctor. By 4 to 5 months, they start rolling over. It should be there by 6 to 7 months. Not being there, yes, it's alarming. And by 7 to 8 months, they should be able to sit without any support. If it is not there, alarming. So these gross motor milestones are usually, the parents are familiar. But other milestones, if you take the fine motor milestones, cognitive, social, those things are a bit tricky. So sometimes they might not be able to pick. That's why it's important for you to take your baby to a doctor or to the clinic at regular intervals. That's why they have been asked to come. So use those opportunities.
Just a question now, this is not for the baby but going to the mother or the parents. Do they follow this, doctor, by and large, or you find that most do and some don't, or everybody does?
Yeah.
In your practice, how? Just to know for the interest of our listeners.
Yes, actually most of our mothers are they are following these things. But in rare instances, we do come across moms who are not following up. Because these things are always combined with the vaccination program as well. So we ask them to come for the vaccine at 2 months and 4 months and 6 months and 9 months and 1 year. So usually they come for the vaccine. So they are worried about that. So they want their children to be vaccinated. So our health professionals use that opportunity to look for other things, measure the weight and check the development and look for any other abnormalities of that particular baby. So that's how it's happening.
At least you get what you want to know in another way.
Another way, yeah. It's for our society, yeah.
Well, thank you, Doctor. So time is catching up with us on this segment of the program, and I think we have much more to discuss on this interesting topic of the baby's day 1 to 1 year. But let's just ask you one more question before we wind up, and hopefully we can continue with the same topic the following week at the same time. Doctor, a question that I would like to ask you before we conclude this interview today is now we have come to back again to this 6-month period approximately, and things have been happening. So could you just tell us, you spoke of the vaccination, the 2 months, 4 months, 6 months.
6 months.
Up to that point, what are the vaccinations that are given to the child?
Yes, actually we recommend all of our children are receiving these. There's a vaccine called pentavalent, which contains the particles in that vaccine, same vaccine, which protects our children from 5 diseases. Okay, so it contains tetanus, and then diphtheria, pertussis, and then Haemophilus influenza B, and then hepatitis B. And we additionally give oral polio vaccine. So those are the vaccines that we give at 2 months, 4 months, and 6. We are repeating the same, and that's what we give within first 6 months.
Just a rider, we have just about a minute more to go. How do babies react when they're given the vaccination?
Yes, that's why there's a remote chance, rare chance of adverse events following this vaccination. So that's why we do it in a specified designated place where we have got facilities to resuscitate in case of an allergic reaction or any other. So we educate them on these reactions as well. Even at home, there are reactions that can happen. But these vaccines are very safe and you don't have to worry about it at all.
So if they do develop a fever or anything, you just prescribe a mild paracetamol or something on those lines?
Yes, the mild fever is one of the very common adverse side effect of these adverse event following vaccination. So we advise them to take the dose of paracetamol which suits to that particular baby. Yes, they can take.
Thank you, Doctor. And there we end this interesting discussion. The first part, of course, on a baby's life in the first year, from day 1 to 1 year. But our discussion has actually covered approximately the first 6 months, and we look forward to continuing the balance part of this 1 year on our program next week. Thank you so much to you, Dr. Hasitha Liyanarachchi, Consultant Pediatrician, Lady Ridgeway Hospital, Colombo, and Senior Lecturer in Pediatrics, Faculty of Medicine, University of Colombo, for being with us on the program in the midst of a busy schedule and sharing our expert knowledge with our listeners. Thank you so much, Doctor.
Thank you very much for inviting me for this program.
Our pleasure. My thanks also to Manjula Senviratna for technical assistance. I'm Fatima Razi saying good night and looking forward to your company next Monday, same time, on Views on Health.